begin. I must see the cervical canal continue as the endometrial cavity, and the upper end of the endometrial cavity must be rounded off. It is in that plane that we measure the maximum thickness, and this thickness should be a 2-layer thickness perpendicular to the endometrial midline, and we must exclude the hypoechoic adjoining myometrium or the junctional zone. That should not be included. If you have intracavitary fluid, you should measure a single layer thickness and say it was a single layer thickness, or you could measure the anterior and posterior and add the two and give a 2-layer thickness. If the patient has an endometrial polyp, the polyp should be included in the endometrial measurement because a polyp is an endometrial pathology. But if you have a submucous fibroid, for example, it should not be included in the measurement because that fibroid is myometrial pathology. Endometrial pathology is best studied in the pre-ovulatory phase where you can see the 3-line endometrium. So any smallest change in this appearance will immediately draw your attention. A mid-position uterus is difficult to study and also to measure at times. When you see an endometrium like this, you really don't know what is happening over here. And if the endometrium is not clearly visualized or you cannot measure it, it should be reported as non-measurable or suboptimally assessed. Remember, your reports must have credibility. If you say an endometrium is normal, it should be normal. If you say there is a polyp, there should be a polyp. And if you cannot see properly, honestly mention in your report that it could not be assessed properly. What is a thickened endometrium? In a postmenopausal lady, acceptable thickness is less than 4 millimeters. So any endometrium which is 5 millimeters or more can be considered a thickened endometrium. Here you can see postmenopausal lady. You can see the arcuate vessel calcification, so you know she's an elderly lady. This endometrium is 8.1, so it is a thickened endometrium. In the premenopausal women, it is much difficult to assign a cutoff because it can vary significantly. Generally, a thickness of 5 millimeters or less is what we see between day 4 to 6. So anything above that you could consider abnormal, or like some people suggest, any value which is more than 15 millimeters at any time of the cycle can be considered at least a relatively thickened endometrium. Here, of course, the endometrium is 2.5 millimeters, 25 millimeters, which is definitely thickened. So let's move on to the first of the polyps. I know this is a mix of gynecologists and radiologists, so I'm going to just mention the common symptoms. Intermenstrual spotting and infertility is a very common presentation of patients with polyps, but many of them are asymptomatic. Here, a polyp appears as a hyperechoic circumscribed area within the endometrium, or it may appear like a thick endometrium. What helps us diagnose it is a single feeder vessel which crosses the endomyometric junction. Remember, any vessel is not a feeder vessel. It should be prominent. It should move from the myometrium into the endometrium. So you get a single feeder vessel crossing the endomyometric junction, and once it reaches the polyp, it may branch within, even in benign polyps. There's a hyperechoic line. Can you see this hyperechoic line? This is seen whenever two smooth surfaces are in opposition on ultrasound. So when I see this hyperechoic line, which is also described as a bright edge, I know that there is something here which is lying within the cavity. So it tells me this is an intracavitary lesion, and it helps me pick up polyps, particularly in patients with secretory endometrium, for example. And it also tells me that this polyp is likely to be benign because benign polyps have smooth walls. So a smooth wall against a smooth endometrium will produce this hyperechoic line. Sometimes you see cystic spaces within a polyp, and you will see that the cystic spaces are restricted to one part of the polyp, one part of the endometrium. The rest of the endometrium doesn't show these cystic. So if you get focal cystic areas, think of an endometrial polyp. Now, cystic spaces are very non-specific. They can be seen in an atrophic patient with atrophic polyp, like here you can see this postmenopausal lady, the polyp was atrophic. It can be a hyperplastic polyp, or it may be a patient with tamoxifen. The importance of cysts in a polyp is that it is rare in malignancy, and therefore if you see it in a postmenopausal woman, you should know the probability that this is benign is very high. Polyps may be single or they may be endometrium, and they're best seen in the proliferative phase here because it stands out very easily within a 3-layer endometrium. So the best time to do evaluation of for a polyp is between day 10 to 12 of periods. Now on 3D you can see a polyp, but you do not require 3D to diagnose a polyp. You may use 3D in cases where there is some difficulty in making a diagnosis, or more importantly when you want to see the margins of a polyp. But to make a diagnosis of a polyp, you can do very well on 2D. Now here you see the endometrial polyp, we say single feeder vessel, but sometimes you see two. One is red and one is blue because it's a pair of vessels. There is the artery and the vein supplying the polyp. The artery is blue because it's taking blood from the myometrium away from my probe into the polyp, and red is venous because it is bringing flow back from the polyp into the vessels. So here you see, first of all, can you see this bright line? Presence of this bright line tells me that there's probably a polyp here, and it is not just a thickened endometrium. And when you use Doppler, you will see you're seeing the blue part is pulsating because the blue is the artery and the red is the vein. And once it enters this polyp, you can see that it is branching within. So arterial flow will be pulsatile, venous won't be, and when you see a pair of vessels, don't think it is two vessels, it is considered as a single set of vessels. Now when we evaluate the endometrium or anything